Thank you for joining us today. We're going to have 3 guests on to talk about different aspects of care for COVID-19 here at UAB. The first is going to be Jordan DeMoss. He's the Vice President of Clinical Operations at UAB Medicine. Then we'll have Mark Wilson, who's the Jefferson County Health Officer. And then we'll have Laura Kowalczyk, who is the Vice President of Supply Chain and Support Services at UAB. First, we'll have Jordan DeMoss joining us.
Good afternoon. I'm excited to announce our first site is opening downtown in Birmingham for our COVID-19 testing. It's in partnership with healthcare leaders across the community and the Jefferson County Department of Health. We know how important access is to testing for our community, and we're excited to bring this to downtown Birmingham. We have plans to expand this throughout our community so that all parts of our community have access. Our site will open this coming Monday at 9 a.m. It will be by appointment only and will require you to call our call center, which is opening on Sunday at noon. We anticipate that we will be able to treat up to 250 patients a day at this site to see them, to visualize their symptoms, and to offer them the test. It's imperative that all patients who are interested in this testing call our call center so that they may be screened and so that we may ensure that we use all the limited resources we have for the optimal use in the community. Thank you.
I'm going to open this up to questions on the call line. Does anybody have a question for Jordan at the moment? Hold on one second.
TM13.
So, yes, can you restart? Thanks.
Sure. This is Jeff Elias off of Channel 13. How are you all doing?
Great.
Okay,
Great.
That's the most important question. But I wanted to ask, in light of the fact that we have essentially thousands of people who have backed up, dozens of miles for tests in other locations, is this amount of 250 a day anywhere near adequate?
That amount is not adequate for the need in the community, and this is our first site that we will be opening. We're working to align access to testing with the lab capabilities that are expanding across our community, and also the testing supplies that are in limited supply across our nation. We do have confidence that over the upcoming weeks, supplies and testing capabilities will be expanded, and we will work hard to bring on new sites as those things happen.
Great. Any other questions from the call line?
This is Mary Scott with WBHM. Can you hear me?
Yes.
Yes.
Okay, I just wanted to clarify because you guys had previously said that UAB would be able to test only inpatients starting today, ideally. So this is a change from that.
So today we launched our testing for our inpatients, our employees at UAB, and our ED patients, our emergency department patients. On Monday, we will expand that to our off-site testing that's in partnership with Jefferson County Department of Health, and we plan to expand that model to other sites with other community partners in the upcoming weeks.
Okay.
Thanks, Mary Scott. Is there another question on the call line?
Just to follow up, I guess, I'm just seeing reports from all over the country, including my home state of New York, where the supplies are just so worrisome of all of these products. Are you satisfied that we're doing enough as individuals, as hospitals, to increase the number of masks? Even one hospital asking people to sew things at home to protect all of their patients and the workers. Can you speak to that?
So my colleague Laura Kowalczyk will be up in a minute to talk about in general the supply need. So I will let her answer that from the perspective of the lab testing supplies. That's one reason it's so important for us to work together as a community, a healthcare community. And I'm certain that we're doing everything we can to find supplies that are needed. At UAB, we are leveraging even our own internal expertise to make some of the medium, for example, for the specimens so that we don't have to rely on the limited supply in the industry. But my colleague Laura will address supplies in more detail.
Any other questions from Jordan before we move on to Dr. Wilson?
Hey, this is Chip Brownlee from Alabama Political Reporter. I'm wondering how the hospital is doing now on patient flow. Are you seeing a lot more patients recently, and are you already feeling any strain from the pandemic?
We are not currently seeing any capacity issues at UAB Hospital. Some of that is because of our proactive stance along with the state and our community to make sure that we look at all services and curtail those that are non-urgent so that we can prepare for any surge in capacity as the upcoming weeks are unknown.
Great. Any final questions for Jordan? Okay, if not, we will move on to Dr. Wilson. Thank you, Jordan.
Thank you.
And just a reminder that the number to call if you would like to set up a time to be screened by phone is 205-975-1881. And Dr. Wilson, who is the Jefferson County Health Officer, he will be up now to speak further about this new testing site.
Good afternoon. I'm really excited to have this new test site come online. We've been working for quite a long time on this. We're very grateful for the team that's come together with a lot of resources from UAB to help with that effort. So we know that a lot of people in the community have been asking about this. We do hear you, and so I'm just really grateful for the partnership, the leadership of the healthcare leaders in the community, and all of us just working together to make sure this happens. And I'm looking forward to getting other test sites open as we're able to do that. It took a lot of work to get to this point, a lot of planning, a lot of teamwork. So I'm really excited to see this happen now.
Does anyone on the line have a question for Dr. Wilson regarding the new drive-through testing site from UAB?
Yes, Jeff Eliasov, once again, would you once again outline the specifics of where and when and how this is going to start up and how you'll limit it, I guess, to the 250 people per day? When does it start and where will it be?
So our site will be located on a former Southern Research Institute site at University in 22nd Street South between 9th Avenue and University. Again, the hours of operation will be 9 a.m. to 1:30 p.m. 7 days per week. It is appointment only, so we'll have a call line staffed by medical providers from 7 o'clock a.m. to 11 p.m. 7 days a week that will walk through a screening process for the testing. So all patients or all citizens that show up at our testing site will have an appointment and will only be seen by appointment 9 a.m. to 1:30 p.m. 7 days a week.
Great. Does anybody have any?
And that begins when?
That opens Monday morning, so the actual appointments will be available, the first one at 9 a.m. on Monday morning, that's March 23rd. Our call center will open at noon on March 22nd.
Sunday, March 22nd. Are there any other questions on the call line for Dr. Wilson from the County Health Department? I'm going to have him walk back in the frame. Any other questions for Dr. Wilson? Okay. Thank you, Dr. Wilson.
Thank you.
And now, lastly, we're going to have Laura Kowalczyk, who can talk about supply chain and services here at UAB Medicine.
Thank you, Savannah. Good afternoon, everybody. I wanted to talk to you a little bit. There's already been a question around supplies. I wanted to share with you what UAB Medicine and Supply Chain is doing and how we've approached the current scenario. I do want everybody to realize that we really have been seeing an interruption in the supply chain for quite some time, and it really escalated in January. And to that end, we actually began our program, and we approached it from sort of a three-pronged step. And that's conservation of material, that is sequestration as much as we can of material. And then we have begun and for some time have been in the throes of alternate sourcing and procurement. And I know that there was a question already around some of these alternate approaches. I want to let you all know that the community has been unbelievable in their response. And we have actually had to set up some separate lines and communication so that we can take in all of the suggestions and all of the donations that we're receiving. So I do want to make it very clear we thank you all for all of that. I was fortunate enough today also to get on the phone with some of our global manufacturers. And so if there are any questions about what we see globally and what we see coming in the future, I'm also very happy to answer those questions.
Great. So we're going to open it up. Any call questions?
Hi, yes, this is Henry Thornton from, hello?
Yes. Hey, sorry.
No, all right, so this is Henry Thornton from Yellowhammer News. Dr. Kowalczyk, so in Dr. Harris's remarks as the state health officer, as I think probably everyone listening to this already knows, he has identified two things as the main sort of choke points in opening up test sites, that being protective gear for the people at the screening site conducting the taking of samples, and also the actual swabs. Could you talk about those two things, and about which one has been a bigger challenge for UAB?
I don't know that I can tell you that either one of them has been a bigger challenge. They are both a challenge, and they are both nationally a challenge. So I'll go back to what I was describing earlier, and key to this is conservation. And we work very closely with our clinical teams to make sure that we are allotting the appropriate protective gear to those folks that need it the most on our front lines. That is a daily process that we engage in at least 2 times a day to assure that we are providing that equipment judiciously but to the appropriate frontline individuals. Also, our sourcing team has been very fortunate at being on the front lines around the swabs. I will tell you that is a limit nationally. We have very strong relationships with our manufacturing partners and continue to have conversation about being on the front lines and our ability to procure that material as quickly as possible and mobilize the team to do that.
Great. Any other questions for Laura?
Yes, Laura, just to follow up, Jeff for Channel 13, can you explain, without having to catalog every one of these calls that's come in, what really is useful now? Should people, as I saw in Washington State, get out sewing machines and make masks that you get a template from and have folks sterilize them? I mean, I don't think any question at this point is dumb. What can we do to help you, help us?
And if everyone can mute before Laura starts, just so we don't get any back, just mute your line. Thanks.
You know, that's a great question. I appreciate the question. And I'm going to tell you that we see no idea as silly. We've actually, being on a university site, we have received phenomenal ideas. We're actually categorizing that. What you mentioned about reusables, that is an option. Believe it or not, that option is also limited in supply. So we began very early trying to procure reusables, have been successful in some regard to that end. We have partnered with a group of individuals who actually do have the ability to sew that material if we need to go to that level. What we have done is we have tiered our process, and we have certain trigger points where we will then know what our next level of options are in working with our infection preventionist as well as our clinicians on what those options may be. I would like to let you know that globally, production has started in China. They have only about 50% of their workforce has returned. They are about 6 to 8 weeks behind in production of masks and isolation gowns. But we are going to start seeing some relief, but I will tell you we probably won't see the relief we completely need until probably summer, maybe late summer. So we do have to continue to think through those ideas and how we can best protect our healthcare workers.
Any other questions for Laura on the line?
Hey, this is Chip Brownlee again from the Alabama Political Reporter. Yesterday during the press conference with the Alabama Department of Public Health, Dr. Williamson was talking about ventilators and planning ahead for that and saying that he was concerned that Birmingham in particular has not as much of a surge capacity really as the rest of the state because there are so many beds and ventilators already in use in the area. What are you doing? What is the hospital doing to plan ahead for the next couple of weeks when some people say that the number of patients could really skyrocket and need that type of care?
Yes, I'm gonna respond to you from the supply chain perspective. There are many clinical discussions that are occurring around the ventilators and that type of life-saving equipment. I will tell you from the supply chain, again, we began very early to look at our options for procuring and renting additional vents. Once again, nationally, and I think you hear it on the national news as well, for all of us in every hospital, we are not unique at UAB. There is a limitation of the ventilators. So we are doing our best, again, to look at our conservation, to look at our options, and also to see where we have alternate channels to either procure or to bring in that equipment.
Any other questions for Laura?
This is Jennifer with WSFA. Yesterday, Dr. Don Williamson explained that during the H1N1, the state was forced to move around ventilators to meet all the demand. Was UAB part of that, and did you run out of ventilators during the H1N1 situation?
So I will tell you I was not at UAB at that time. I cannot answer that question. I don't know whether Jordan is aware of that, so I'm not able to answer that question for you. Yeah.
Thank you.
Thanks. Any other questions for Laura? Okay, if not, thank you, Laura.
Thank you.
Just a reminder on the appointment-only downtown testing site. So at noon this Sunday, March 22nd, those who are symptomatic and think they have COVID-19, cough, fever, shortness of breath, can call 205-975-1881 for a provider screening. And at that point, after you're screened, they'll make you an appointment if medically necessary. We will be sharing a news release about this here in the next few minutes. So if you do not get it in the next 30 minutes or so, please let myself or Tyler Greer, tgreer@uab.edu know. Thank you.